then naturopath. Is CanXida Remove any good for intestinal inflammation or diarrhea? Well, it is. It's very, very good for intestinal inflammation. So many people will have said to me in the past, why would I take a product like that when my gut's inflamed? I've got inflammatory bowel disease. Then in my next breath straight after they've said that is, show me the stool test results. And then, okay, I get a copy of the stool test and I'd say, whoa, you've got a lot of bad bacteria here, mate. Bacteria up really high. You've got 3 or 4 plus levels of many dysbiotic species here. I notice also that you've got very, very low levels of beneficial counts. So this is what I often find when it comes to inflammation in the gut. Low level of good, high level of bad. Sometimes it's just straight yeast problem. Other times it's a combo of yeast and bacteria, or it could be a straight up bacterial SIBO kind of case. But often we'll find large amounts of stuff there. So diarrhea, I'm thinking parasites, I'm thinking Giardia, I'm thinking lots of different potential bug scenarios here. My next question to a patient who's got diarrhea is A, how long you had it for? B, have you been traveling anywhere or gone to overseas countries? And often that's where they stop me and they'll say, I just came back from Bali for 2 weeks, or I was in Cancun for a month. One lady went on holidays in Mexico and she drank water out of a dog bowl because there was no other water around, so she saw a bowl on the ground, drank it, and then when she got home, and she said she had the most horrendous pain for months and months after. And I said, well, what the hell are you drinking out of a dog bowl for? But that's how you get parasites, things like that. Not one moment of not thinking can be a whole lifetime of madness. We had a patient from the South Island, this lovely lady, an actress. And she spent a considerable amount of time doing movies and stuff over in the Pacific. And she was moving from one bowel case to another bowel case, getting all these types of different presentations of diarrhea and pain. And the stool test results blew me away. They're one of the worst I've ever seen. Constant diarrhea for multiple years, solved with CanXida Remove. We had this lady on Remove for 3 months, slow dose, medium dose, and then we cranked the dose right up. We had a fantastic outcome with the diarrhea. So many cases when patients have got diarrheas from parasites and they take treatments, it's often effective with the parasite, but the gut's messed up. And the bowel problem will continue on and on and on, and then slowly it'll get worse. Sometimes the parasite comes back, and this is when a person needs more an effective, stronger treatment than often many of these drugs can provide. And that's again where the diet comes in. So if you've got diarrhea or parasite issues, please watch my videos on how to do a parasite cleanse, because I explain that in great detail. So, but yeah, Remove is good for IBD, inflammatory bowel disease. It's also good for IBS, irritable bowel syndrome, and I've used it very effectively for parasites as well. So the answer is yes, it will work. If you've got acute blood coming from the back passage though, if you've got a bad acute bleed, you'll need to see a doctor. That could be a medical emergency. So I've never suggested our products like cure people from all diseases and things like that. We don't talk like that on this channel. But I'm just saying assisting and supporting and helping. But if it's a bad one, you need to see the doctor. Thanks for tuning in.